whey protein had no impact on HDL, meaning that is the quote-unquote good cholesterol, but there was a reduction in LDL, which is the bad cholesterol, in individuals under the age of 50 when it was combined with exercise. So in individuals who were exercising and consuming whey protein, they had a reduction in cholesterol levels. If you maintain muscle strength, this is well correlated with longevity. For instance, a 2018 study looked at over 4,000 adults over the age of 50, and there was a 200% increase in all-cause mortality in the group that had low grip strength. So now you might say, why is grip strength? Well, grip strength is probably a reflection again of that overall vitality. And so it's very important to maintain our muscle strength early as we go forward. Welcome to Foundations First, Health, Strength, Success. We're building tomorrow starting today based on scientific evidence. I'm Dr. Patrick Denard, an orthopedic surgeon with an interest in health and wellness. And today's podcast is protein, myths versus facts. So protein is all the craze right now. You're hearing a lot about it in social media. We're seeing the carnivore diet, for instance. So I thought it would be good to dive into some of the science around protein, how protein is beneficial for you, and look at the different types in some of the studies. Today's podcast is sponsored by Complete Surgical Nutrition. The average American will have 6 surgeries in their lifetime. Evidence shows that nutrition is an important part of recovery. Supplementation can improve speed of recovery and lower the risk of complications. CSN was formulated by surgeons to help optimize your recovery after surgery. If you or a loved one are having surgery, more information is available at www.completesurgicalnutrition.com. Probably more important than the type of protein is that you're getting adequate protein intake. And the biggest thing, we can get in a big debate about the different sources, but the biggest thing is probably getting that adequate protein intake, which we'll hit later in the episode. So why is protein important? Well, one of the big things is that muscle mass decreases as we age. So beginning in the 4th decade of life, so we're talking age 30 on, muscle strength decreases 0.5% per year. So in other words, on average, if you just live a regular life between the ages of 30 and 70, you're going to lose 20% of your muscle mass. And the more we can do to offset that early and prevent that decline or optimize where we are at the beginning, be at a higher point of the curve, the better spot we're going to be later for living a healthy lifespan, not just a long lifespan, but a healthy lifespan that's going to help us live our best lives. So one of the major goals of protein intake is to offset this muscle loss. And by doing this, we're going to have increased vitality and also prevent falls. For instance, falls actually are the leading cause of accidental death over the age of 65. And that's because individuals in that category tend to have less muscle, less balance, and by doing less strength training and having protein intake, they have decreased bone density, so they fall and they have an accidental death. For instance, if you break your hip over the age of 65, you have a 1 in 3 chance of dying within 1 year because it really reflects that overall health. Conversely, if you maintain muscle strength, this is well correlated with longevity. For instance, a 2018 study looked at over 4,000 adults over the age of 50, and there was a 200% increase in all-cause mortality in the group that had low grip strength. It was 20% of the participants who had low grip strength, and they had a 200% increase in all-cause mortality. So now you might say, why is grip strength? Well, grip strength is probably a reflection again of that overall vitality. And so it's very important to maintain our muscle strength early as we go forward. So let's start with some definitions first. So we have lots of different types of protein. Now, whey protein is animal-based protein. That's going to be found, for instance, in milk. Most or many of the protein supplements, you'll see WHEY, whey protein, advertised. Soy protein comes from soybeans. Vegan protein can either be soy or pea or protein are the most common. Now, there's this debate about which protein is best. You'll see critics of soy protein, for instance, cite that there is phytoestrogen and reduced ability to get calcium, iron, and zinc, as well as B12. They will also talk about GMOs. Critics of whey protein, on the other hand, will talk about kidney and liver function, that whey protein can perhaps cause acne. And then there are some people who just have an adversity to animal products in general. So what is the difference between these type of proteins? So I think it's first important to talk about the composition of the different protein types. So this was evaluated in a 2019 study published in Nutrients, and they looked at several different types of protein components, including casein protein, whey protein, soy protein, and pea protein. And first off, when you look at the composition of those proteins, you see a different amino acid profile. And there's a lot of differences, but the biggest difference you will see is that you see the highest amount of leucine, and we'll get into leucine in a little bit, in whey protein. So you'll see a higher concentration of leucine, which is really important in muscle synthesis. Now, in this study, they had 14 participants. They simply had them consume the different types of proteins. And what they showed was that their post-consumption, meaning after they ate, amino acid profile was in line with what was actually inside the protein powder. In other words, the highest concentration of leucine after consumption was after consuming whey protein, and the lowest was after consuming soy protein. So another way of looking at this, the study also looked at the evaluation of protein composition and amino acid profiles, and then flipped this around to how much do you actually need to consume to get equivalent amounts. So a number that is roughly out there is about 3 grams of leucine that is ideal to consume for muscle synthesis. And when you look at the amount that you have to consume, for whey protein, it's about 32 grams, which is pretty typical. Whereas if it's soy protein, you have to get 55 grams to get the same amount of leucine in that serving, which is quite a bit. If you're getting a 55-gram serving, you're either consuming a lot or you're going to get a drink that is going to be very sort of chalky, more like a milkshake than a typical protein powder that you're mixing. Now, the reason I keep hitting on leucine is that there are different amino acids, and these amino acids have a different impact on muscle protein synthesis. And leucine is an essential amino acid. Essential means you cannot make it within your body. So you have to obtain it from your diet. And leucine activates the mTOR pathway and is thought to be the most important amino acid in producing muscle and preventing muscle breakdown. So if you're trying to maintain strength, it's really important that you have an adequate amount of leucine. And again, it appears that that dose or amount is about 3 grams per serving. What's also interesting about the data here is that there appears to be some trade-off where as you get increasing amounts of protein, the benefit of the leucine actually decreases. In other words, what you're trying to do is have a high concentration of leucine. So when I talked earlier about with soy protein having 55 grams, for instance, to get the same amount of leucine, that may not be as efficacious in your body as having a lower amount of protein with a higher concentration of leucine, because you see as the amino acids interact, you actually get a plateau of the muscle protein synthesis cascade. Now, that said, what do we know about resistance training and protein content in individuals? So one study published in 2021 in the Journal of Sports Medicine looked at a high protein plant-based diet versus those who are matched to an animal-based diet. So they had 19 vegans and 19 omnivores followed for 12 weeks. And actually in these active athletes, they found no difference in lean mass or strength between groups. So you would hear that and you would say, well, it really doesn't matter what type of protein intake I consume. However, it does appear that there may be a shift that especially occurs later in life. So the study published from the Framingham cohort followed older individuals over time. This was a 6-year follow-up of 1,700 individuals with a mean age of 59 years, range of 29 to 85. Now, they found that higher protein content, regardless of source, was associated with less decrease in grip strength. Again, there's this phenomenon that's going to occur. You're going to lose some grip strength and muscle mass with time, but you got less loss per year. So it was 0.2% loss per year in the upper quartile versus 0.6% in the lower quartile. But what's interesting is for older individuals, so they define that as people over the age of 60, animal protein or whey protein led to a lower decrease in grip strength. So it may be a consideration as we age in particular to think about having that content that is higher in leucine to preserve muscle mass as we age. One of the other debates that comes up with protein content is inflammation and what does this affect on your body? So a systematic review from the British Journal of Nutrition in 2023 looked at this. They evaluated 31 studies, so quite a few studies. And again, a systematic review is where you take multiple studies that have small numbers, you try to combine those into a large analysis so that you can produce some meaningful results. Because with small numbers, you may have a finding, say you have 20 or 30 people involved. One change or one person can really affect the results. By combining, you get several hundred or several thousand people, and now you can really try to look at this and perhaps have a higher quality of evidence. So their aim was to compare whey protein and soy protein and the impact on inflammatory markers. These include a CRP, which is a C-reactive protein. We'll commonly see this elevated in people with heart disease or in people who have infection. Another was IL-6, so interleukin 6. And the third was TNF-A, or tumor necrosis factor alpha. And they looked at this in individuals over the age of 60. Now, both actually had a positive impact in reducing inflammation. Specifically, whey protein led to reduction in IL-6, whereas soy protein led to reduction in tumor necrosis factor, or TNF. So both protein types actually appear to exert anti-inflammatory properties. In subgroup analysis, whey protein was beneficial, particularly in reducing IL-6 levels in those with sarcopenia. Now, sarcopenia, again, is age-related muscle loss that occurs specifically in older individuals. It's quite common. It's a diagnosis that is made on multiple factors, but it gets back to what I was talking about earlier with the benefits of whey protein, especially in older individuals, and having that high leucine content and perhaps improving muscle mass, but even specifically reducing inflammation in these individuals. So one of the benefits of whey protein, aside from muscle mass, is actually a potential benefit on cardiac health. So a systematic review in 2024 looked at 21 studies. This was published in Clinical Nutrition. And the background here is there's this thought that whey protein may actually help reduce cholesterol absorption and down-regulate cholesterol production in the liver. So when they looked at all these studies and combined them, they found that whey protein had no impact on HDL. HDL is your high-density lipoprotein. That is the quote-unquote good cholesterol. But there was a reduction in LDL, which is the bad cholesterol, in individuals under the age of 50 when it was combined with exercise. So in individuals who were exercising and consuming whey protein, they had a reduction in cholesterol levels. Total cholesterol was reduced with whey protein plus exercise regardless of age. So we're seeing evidence here that protein helps drop your cholesterol levels, specifically the bad cholesterol levels. And what's interesting is that reduction was regardless of weight or body mass index. Whey protein supplementation over 12 weeks also reduced triglyceride levels, which is another important factor to consider in your cardiac health. There was no impact on blood pressure. So to put this in context, as the author stated, how much impact does this really have on cardiac health? Well, their analysis showed about a 5-point reduction in LDL levels when protein was combined with exercise in individuals under the age of 50. So what does that 5 points mean? If you look at that, that equates to about a 1.5% reduction in all-cause mortality and a 2.5% risk reduction from coronary artery disease or heart disease. Now, those may not be like large numbers if you just hear that, but remember these are individuals under the age of 50, and we're trying to modify cholesterol levels early on so that you get better benefits later in life. So the more you can do to prevent early, rather than waiting to treat, if you can keep the levels down, that probably has an impact, because when you get cardiac disease or heart disease late in life, it isn't something that started at age 65 or 70. It's a process that started in your midlife. Furthermore, as the authors state, the reductions in total cholesterol, not just LDL, were between 5 and 12.5 points when whey protein supplementation was added. So when linked to a previous meta-analysis that looked at heart disease mortality, that reduction equates to a 54% reduction in heart disease at age 40, a 39% reduction at age 50, a 27% reduction at age 60, and a 19% reduction at age 80. So when you look at all the groups and look at it over time, this gets back to what I was saying about trying to prevent that cholesterol accumulation that occurs slowly over years and decades and really adds up later in life. An additional benefit of protein intake is that there is relationship to glycemic or glucose control. And increasingly, we're recognizing that it's important to keep your glucose levels lower in your body. And some of this probably is just simply consuming protein. It's going to offset other foods that lead to these glucose spikes, but there's also probably a metabolic process that occurs that helps drive down glucose levels. So there was a study in 2021 published in Nutrients that looked at 14 women with polycystic ovarian disease, and they matched these women to 15 controls. Now, these were young women. Their ages 22 and 21 on average, meaning they're very young individuals who have either normal or this condition of polycystic ovarian disease. Now, polycystic ovarian disease, it's associated with diabetes and a non-alcoholic fatty liver and insulin resistance. It affects about 6 to 9% of premenopausal women. It's linked with obesity. Essentially, what you're looking at here is a metabolic disease where you have high insulin levels, you get insulin resistance, you get suppression of sex hormone binding globulin by the liver, you get elevated liver enzymes. That's where you come in and get non-alcoholic fatty liver disease, despite not having alcohol intake. So you get liver disease even without having alcohol that's having the result. That's why it's called non-alcoholic fatty liver disease. Now, this can progress over time to hepatitis, cirrhosis, or even liver cancer. And women with polycystic ovarian disease have an elevated cholesterol due to decreased cholesterol efflux. The recommendation, generally speaking, is to lose weight, and that can help decrease or offset the non-alcoholic fatty liver disease. Whey protein comes in as a way to increase amino acid intake, as I mentioned, but also produce satiety, meaning less desire to eat, and drop glucose levels. So in this study, the women had 3 visits, days 0, 1, and 7 of their menstrual cycle. The reason they did that is they wanted to control having hormones as having an effect on their glucose level. So on day 0, they ingested 250 milliliters of water prior to a glucose load test. So they took about a glass of water, and a glucose load test is where you take a large amount of glucose, drink, and then you measure glucose after that test. On day 1, they had 250 milliliters of water with 35 grams of whey protein prior to the glucose load test. And then day 7, they repeated what they did on day 1. So days 1 to 7, the individuals were instructed to have 35 grams of whey protein prior to lunch, not change their other habits, and they did blood samples. So when they look at the results of glucose levels, you see that both groups have a spike in glucose levels after consumption with this test. But what's interesting is the differences. So the control group have a drop. So they both spike within 30 minutes, but then the control group rapidly has a response compared to the group with polycystic ovarian disease because they have more impairment in their insulin response. However, when you add in protein, you see that the group with polycystic ovarian disease essentially almost normalizes compared to the control group. In other words, by consuming whey protein, they did not have those spikes that they were previously having. So the authors conclude that whey protein ingestion results in a reduction in hyperglycemic, meaning elevated glucose levels, which in the long term actually may be better for treatment of type 2 diabetes. So 2 other things that I think are interesting to review is that our gut health and overall how much protein intake you should have. So there's actually a lot of interest now on gut health and the microbiome and how it affects your overall health. There's actually evidence from a study in the gut health that whey protein actually has a positive benefit in the bacteria in your gut, and that having whey protein as a supplement may actually help promote overall gut health. So how much protein then do you need? Well, the data suggests that you need somewhere between 1.2 to 1.5 grams per kilogram of body weight per day. And that in combination with exercise is extremely beneficial in reducing overall mortality, as it is shown in multiple studies and we have highlighted today. So what does that equate to? Well, on average, if you look, you can calculate your kilograms very easily. Just go online and Google it. But essentially, the average person is about 70 kilograms. So if you're looking for 1.5, you're talking about getting 100 grams of protein per day. Thinking back about the data on how much you can consume at once, seeing that there's a trade-off of getting too much protein at once. Generally speaking, you're looking for somewhere between 25 to 40 grams of protein per sitting, which means if you just went 25 to get that 100 grams, you really need 4 servings of protein a day. Now, as we typically eat, breakfast, lunch, and dinner, what that means for many individuals is finding a time to consume an additional protein shake per day if you're going to try to meet these levels that are going to help reduce your overall mortality and maintain your muscle strength. So let's kind of summarize the main points from this podcast. Number 1, whey protein has a higher content of leucine, and leucine is very important in muscle protein synthesis. That appears to be, based on the data, particularly beneficial in older adults. We define that as individuals over the age of 50 to 60. Younger individuals, even in athletes, it doesn't appear to affect their performance if they're using other protein sources. As long as they are getting adequate protein intake, I would highlight as long as we talked about in the previous podcast, it is frequent that athletes are not getting enough protein intake and having consequences such as stress fracture, etc. But if you just compare head to head, as long as they're getting enough protein, they appear to do well at a younger age. Stepping back, I would say in this debate about what the protein type is, it doesn't matter as much as getting the proper amount of protein, which is 1.2 to 1.5 grams per kilogram of body weight per day. I think if you do that and consider that in divided doses, you're going to be in a really good position. And aside from these benefits of muscle, you see that protein appears to reduce inflammation. It has improved cardiovascular parameters such as cholesterol that relate to mortality. It helps with glucose control. And then lastly, it appears to help with the gut microbiome. So there's lots of benefits to protein. Really think about analyzing your intake and see how you can get to those guidelines and meeting that on an everyday basis. I hope you enjoyed some of those facts about protein, separating the myths from the facts, the different types that are out there. If you're so compelled, please leave us a 5-star review. If you're following us on YouTube, like, subscribe. And in the next episode, we're going to talk about the science of long-term healthy relationships.